Good morning. We've got our first complete line press conference this morning. Our numbers today, we have 3 positive cases, 82 negative, 6 pending, 7 in quarantine, 1 in isolation, and unfortunately 1 death from COVID-19 in our community right now. Those 82 negative cases are from the public health lab only. I'd like to just do a quick round of introductions with our healthcare partners before we turn it over to Ramstrom. And let's start with Medical Center.
Good morning. This is Robert Folden from Mercy Medical Center. No real new update today. We continue with our visitor restrictions. We continue with limiting surgical procedures to only those that are necessary. And we're just continuing to work with staff and kind of work through this in the long term.
All right, thank you. Shasta Regional.
Hi, my name is Mitchelson. I'm the nursing officer here at Shasta Regional. And similar to us, no major changes from yesterday, just working on internal and external communication with staff in the community and just continuing like yesterday.
All right, thank you. And from Mayors?
Good morning, I'm Valerie Laley from Mayors Memorial Hospital District in Fall River Mills. Same thing, not a lot of change from yesterday, but I would like to note that we continue to plan and prepare. We've all been participating in a tool that has been put out by the California Hospital Association, which is helping to track our resources. And so that, as you know, this is a marathon, not a sprint. And we're trying to pace our employees and give options with that valuable workforce that we have.
All right, thank you, Val. All right, good morning, Dr. Ramstrom.
Thanks, Carrie. Good morning, everybody. As was mentioned earlier, today we're reporting our first death in Shasta County due to COVID-19. Can you hear me? Can you hear me?
Yes, I can hear you now.
Okay. So good morning, everybody. As was previously mentioned, today we're reporting our first death in Shasta County due to COVID-19. The Shasta County resident was a woman in her 70s who was hospitalized and confirmed to have COVID-19 on Sunday, March 22nd. She passed away yesterday. Our deepest sympathies go out to her loved ones. As was previously reported, Shasta County's 3rd case was confirmed earlier this week and was a close contact of the deceased. So to recap our totals in Shasta County, we have confirmed a total of 3 cases of COVID-19, 2 of which were travel related and 1 a close contact. So this is an important reminder to all of us of how serious the situation is and for all of us to take care, to stay close to home and limit our contact with others. We know this isn't an easy situation. It involves sacrifices that we're all making, but it is necessary to protect ourselves, to protect our loved ones, our family, friends, and our colleagues. It's also important to recognize how essential social distancing is and staying at home to protecting our healthcare workforce. We rely on our healthcare system to provide a range of essential medical services every day, and we cannot overburden our healthcare workers with a respiratory illness that is preventable by limiting our contact with others. So these are practical realities and potential consequences if we are lax about social distancing. So now is the time for all of us to please do our part, find creative ways to support each other and our community from afar. Thank you.
All right, thank you, Karen. Did you have anything to add, Brandy, before we open it up to questions? Okay, we are ready for media questions.
Yeah, I have a question for Dr. Ramstrom. Are there any special concerns regarding the homeless population, and if so, especially at the Mission?
That's a great question, and we've been concerned about that population from the start. We have dedicated staff in our agency and other community partners that are working on that. There was just this morning, so I was not able to be on. Was there anything that was mentioned in that call that we update the community on?
Nothing specific. We are just working with all of our partners to make sure that we have a place to for the most vulnerable populations to go in case they need to be quarantined and isolated. And so those details are being worked out, and I think there will be more updates in the coming days.
Okay. Do you guys have a plan or anything if a case does happen to turn up in the homeless population? Such as, like, I don't know, renting a motel or anything like that?
Yeah, that's what we have done in the past. We have other communicable diseases where people have needed to be isolated and they have not had a place to go. So what we do in those situations, in those limited situations, obviously this is a little bit different, but in those other situations, we've rented a hotel room and made sure that they had adequate food and essential needs and services so that they were encouraged to stay isolated.
Thank you.
All right, any other questions?
I'll have one on Twitter with the health department. It said the epidemiologists are working on projections for COVID-19, like maybe how widespread it might be. Is that still being worked on? Is that available?
Yes, our epidemiologists are still working on those projections along with their counterparts throughout the state to try and get a real good idea of what is happening in our community, in our state.
I have a question regarding was it one of the families? Can you confirm more? Was it one of the family members that contracted the virus? That was the contact.
I think I heard the question. So the third case that was confirmed this week was a close contact of the deceased.
Thank you.
Now, regarding the recent death, is this a sign that things are going to get worse, or is this woman just happened to have kind of a compromised immune system already?
You know, I think that we can expect this is going to get worse. We anticipated that even before this death. I think that we have more unidentified cases that we will be, become apparent in the not so distant future. I hope that people staying at home is going to slow that number down by social distancing so that we're not contacting each other and potentially contracting that infection. So I do think this is a reminder that things are expected to, we're expected to have additional cases, yes.
And do we know which hospital the woman passed away at?
So public health, we defer to the family if they'd like to share that information, but we are really careful about protecting the information that is shared with us about these individual cases, and so we would defer to them.
Okay.
Here's one that's been asked before, but the woman who passed away, I know there's a lot of questions about where she traveled within the city or the county. Is that ever, I know in the past with measles cases, those patients have been, where they went have been publicized. Is that something the health department's going to publicize so people can know, like, where she went or where she was?
Yeah, so I'll go ahead and answer that question because I realize that it's confusing to the public why we change our practices with different illnesses. And measles is a very different disease than COVID-19, and it is much, much, much more transmissible. So with measles, it's an airborne transmission. So people much farther away from an infected person can get it. And so there's a much more risk if you are in the general vicinity of where someone is at for you to contract that illness. With COVID-19, as we've talked about before, it's droplet transmitted. So you have to be in close contact with the individual which means 3 to 6 feet for a prolonged period of time, not just walking by them, unless of course they just happen to cough on you right as you walk by them. So that would, I guess, be different. But so I did want to take this opportunity to kind of explain in a little bit more detail what we do to ensure that the risk in the community is lowered. So ever since we learned about the first case on Sunday, or the second case, I'm sorry, on Sunday, and then quickly thereafter found out that a close contact of that case had also tested positive, we've been doing investigations with the individuals and their family members, trying valiantly to find all of those people who we would consider to be at highest risk. So those would be the close contacts who have been in prolonged contact for 3 to 6 within 6 feet for a prolonged period of time. So when we identify someone who we believe to be at highest risk of actually becoming infected as a result of that contact, we put them under a health officer order. And there are very specific guidelines about those folks. And they go into quarantine for 2 weeks. And right at this second, we have the practice of calling those individuals twice a day to make sure that they are still not exhibiting symptoms. And if they are exhibiting symptoms, then we would arrange for them to be tested right away. And so then they would become a case and we would start that process all over again. However, with the containment measures that we have been put in place, such as quarantining those close contacts, it is much less likely that they will have as many close contacts because we will have been monitoring them and they will not have been out and about. They will have been kind of at higher level of awareness of what their symptoms are. So that's how we protect the community from the risk of the situation. But I would like to emphasize that that is our practice right now, and it is a good example. And so that is not a perfect science. And we encourage people to take proper precautions and to follow the governor's stay-at-home order to limit their exposure to other positive cases that might be in Shasta County that we do not know about already. The other thing I would like to say is that we are actually also involved in contact investigations with other counties. So we have people in Shasta County who have been identified as close contacts of positive cases in other counties. And so that just really emphasizes the fluidity of which, how our daily behavior through our travels really don't protect us much. The Bay Area has been experiencing widespread transmission for weeks now. And I believe that some of them are no longer doing those containment measures. And so it's really important for people to know that they need to not be traveling to other counties and other states and really following the governor's stay-at-home orders.
Okay.
Thank you, Brandy.
Can I ask one real quick question? What's the difference between a quarantine and being isolated?
Quarantine it's a really subtle difference. We put people on quarantine who are not currently symptomatic. And if they are symptomatic, then it's called an isolation order, which Karen signs and implements.
Okay.
All right, what other questions do you all have?
Is Barry Tippin available for a question?
Yes, there.
There he is.
Okay. I'm just curious, we've had a lot of reports of people out on the Sacramento River Trail and at King's Kingdom, and they're not practicing social distancing. Kim Niebuhr yesterday said the city is monitoring it. I'm wondering if there's any change today on disallowing people from going to the parks or the trails?
So we're continuing to monitor it, as Kim said. One of the things we did yesterday is that we posted signs around our facilities, letting parents in particular know that all the playground structures are not being sanitized, so that they are aware. I presume they knew that already, but it's always good to err on the side of better communication. We're watching. I think it's one of those things that we have. The social isolation. People still need to exercise, walk their dogs, etc. And so we're trying to make the parks available as we can, but we also are watching to make sure that they're not being abused. For instance, driving by Enterprise Park over the weekend, there was a fair amount of use there, but most seem to be adhering to the social distancing guidelines. If it gets worse, then we may follow sort of the state, which began closing parking lots for access to beaches. We may close parking lots to trailheads and our parks in an attempt to limit the amount of people who are using the parks. We're trying to avoid a situation where we close down parks and then we have an enforcement issue while people are just trying to exercise.
Any other questions?
Oh, well, I have another one for Barry. How long do you think maybe the city hall will be closed to the public?
That's a very good question. We're not sure about what the answer to that is. Obviously, we're running full services right now. You can look at our website to find out hours and how to contact the housing department or permit center so that you can get permits for water heaters or new construction, which is allowable under the governor's orders. We're taking the lead from both the state and county public health in terms of how best to proceed. Part of our issue with closing City Hall is that we're trying to encourage staff to telecommute as much as possible, and so we have less staff to actually serve the public. And so having it in a appointment only or through drop boxes allows us to actually use the staff we have and the maximum service to the public.
So one other quick question. So the police are not going to be going out enforcing stay-at-home rules at the present time, or even restaurants that might be open?
Yeah, I think, law enforcement is working closely with the county, and county law enforcement, the sheriff, and as well as Anderson. We're trying to make sure we're operating in the same manner. I would say what we're doing right now is a soft touch. If we have restaurants or others who are not adhering to the governor's orders, we're trying to make contact with them. We're also working closely with public health and making sure that we're in line with what they are operating under as well.
All right, thank you.
Other questions? Okay. Anything else anybody'd like to add before we sign off? All right, we encourage everyone to visit our webpage at shastaready.org. We've got lots of questions answered on there and lots of information that hopefully is useful. And then follow all of us on Facebook for up-to-date updates between now and tomorrow's news conference. All right, thank you everyone for being here. Thank you for your patience. We'll post this video as soon as we get it in our email box. We'll post it on Facebook so everyone can see. All right, thanks everyone.